Hello there, my name is Dr. Usman Ahmed. I'm a consultant in general medicine and I'm based in Northwest London. Today I'm going to talk about tiredness and how tiredness can manifest in patients and how we can diagnose and further assess why a patient may feel tired. Now, tiredness is very different from just having one night of poor sleep and feeling a bit tired the next day. Tiredness, or another word we can use for tiredness is fatigue, is difficulty with fatigue or tiredness every day, really struggling to do your activities of daily living, function, work, etc., or exercise even. And there are many causes of tiredness. As we've mentioned sleep, if we look at sleep itself, sleep can be a difficult thing to diagnose, but there are some things we can ask in the history to try and identify how one sleeps. So, do patients have difficulty going to sleep at night time? Once they are asleep, are they waking up at night time? And do they feel like they've had sort of a good night's sleep in the morning? Are they feeling tired in the morning? How do they feel when they wake up? Do they have pain around their forehead, around their sort of sinus area? Do they wake up with headaches? This may really point to what could be going on. There are some sleep disorders that we know, such as obstructive sleep apnea, that could be causing patients to become quite tired. So it's very important to try and identify how well a patient is sleeping. Other forms of tiredness and fatigue, it's very important to get a history. So it's very important to actually just go through a patient's day. How are they in the morning? Do things improve throughout the day? Are patients drinking excessive caffeine drinks such as tea or coffee to try and keep them awake in the day? Or are they okay in the day and the tiredness really just kicks in towards the end of the day? Are there any other associated features with tiredness? Do they feel breathless? Are they losing weight? Are they sweating excessively? Or are they developing pains in any of their joints, or developing headaches or back pain or neck pain? Again, this can really point to the different causes of tiredness. When examining patients, it's very important to do a full examination, do some baseline observations, to check a patient's oxygen level, check their heart rate. Do they have a high resting heart rate? Check what their blood pressure is like, and then doing a full cardiovascular respiratory examination, looking at their neurological system, so their muscles, their upper limbs and lower limbs, and ensuring there's nothing else that appears abnormal. Also checking what their muscle bulk is like, and do they have good strength overall. So once you've done the history and examination, it's important to consider the causes of tiredness. When investigating patients with tiredness, once you've done the history and examination, you have to really tailor the investigations according to what they've told you. Blood tests are always very helpful for patients with tiredness. So I would do a full range of blood tests, essentially a full blood count. So this would look at a patient's hemoglobin level, because anemia can be quite a debilitating cause of tiredness for some patients. I would look at their white cell counts and their other counts within their bloods to ensure that there isn't an underlying blood production problem or an infective process that's going on. I'd want to look at their kidney function, their liver function tests, whether they have inflammation in their blood, and probably a few other markers based on what they've told you. Once you've done baseline blood tests, very important to do a bedside ECG and possibly an echocardiogram. So an ECG looks at the heart function, and echo also looks at heart function. ECG looks at electrical rhythm, and echo looks at the actual pumping function of the heart. You may want to consider some imaging such as a chest x-ray, or if you're concerned about any other features of tiredness, maybe a CT scan of the relevant organs. We talked about sleep at the start, and one of the things you may want to do with sleep is to actually look at some sleep studies. So what sleep studies do is they look at the quality of your sleep. They look at your oxygen levels as you're sleeping. And there may be a pattern there that may be associated with poor sleep, and that can be contributing to tiredness. Going back to blood tests, you may want to think about some additional blood tests, something like your thyroid function tests, some basic vitamins like your B12 folate levels, your vitamin D levels, because this may all point to tiredness. So tiredness or fatigue, as we've said, is quite a concerning and debilitating condition. It's very important to be as thorough as possible when investigating this with some blood tests, some imaging, and then some advanced tests such as a sleep study. If you're concerned about feeling tired or having extreme fatigue, it's very important to see your doctor, whether that's your GP or a general medicine physician. Thank you.